8:10 now, 10 minutes past 8 o'clock with Steve and Ted on 98.7 and 1330 KNSS. It is Wednesday, and that means time for Wednesdays with Wagle. Dr. Jason Wagle with Kansas Perio and Dental Implants. Good morning, Dr. Wagle.
Good morning, Steve.
Sir, I understand you have some valuable information that can help save lives today.
Yes, I do, Steve, and thanks for having me. As many people may not be or may not know, that April is Oral Cancer Awareness Month.
Okay, so how serious is oral cancer, doctor?
It's pretty serious. There's over 54,000 cases of oral cancer diagnosed every year in the U.S., and unfortunately over 10,000 deaths annually.
It's pretty serious. And what age groups are affected?
The average age of diagnosis is early 60s, but 20% of new cases are in people under the age of 55. The fastest growing age group for oral cancer is people under 50, and men are twice as likely to have oral cancer than women, but over time the number of cases in women has increased.
And what are the risk factors here?
Tobacco use is the most important factor, and alcohol use can be a factor as well. People who use tobacco and drink regularly are 30 times more likely to have oral cancer.
Any other risks?
Yes, human papillomavirus, or HPV, is a risk factor as well. There's a vaccine available for HPV that is recommended for young people. Visit with your family physician or pediatrician to see if you or a loved one are a candidate.
What can be done about oral cancer?
Well, as with just about any disease, early diagnosis is key. Your family dentist will conduct an examination of your mouth, tongue, throat, and neck area to look for suspicious spots or sores or lumps.
And what's the survival rate?
The 5-year survival rate is about 50%. This survival rate could be improved if more people visit their dentist regularly and were screened.
What happens when oral cancer is suspected?
Typically, a biopsy would be performed to determine if cancer is present.
And how is oral cancer treated then?
Once the oral cancer is diagnosed, the treatment can include radiation, surgery, or a combination of both. Sometimes parts of the tongue, jaw, or other structures have to be removed.
That's a very strong argument for preventive care.
Exactly. At Kansas Perio, we always stress prevention, early diagnosis, and treatment. And we understand that a team approach to oral health is vital to patient success. The bottom line, Steve, when you visit your dentist, the exam they perform could save your life.
All right. Thank you, Dr. Wagle. Jason Wagle, Wednesdays with Wagle, sponsored by Kansas Perio and Dental Implants. When it's time to get serious about your smile, go to kansasperio.com. Phone number 685-2731. 8:12 now, Steve and Ted in the morning here on